So this video is meant to help others assess the hinge, or otherwise known as the deadlift, in a quick yet efficient manner without having to go through a bunch of different pre-screenings such as the FMS, active straight leg raise. That way, when you work with a client, you can get them into the gym working as quickly as possible, but also safely as possible. When you start working with somebody, you want to make sure that you can find what's called their true hinge depth, meaning that the movement is coming from the hips and not the back. This first test is just a low back tap test. As you can see, the hand is placed on the low back, and when the individual comes forward, the fingers start to splay apart, and that means that there's an amount of flexion in the lumbar spine, which we never want in any hinge position. When we have them redo the test, you can see here, he doesn't get as low. And then when we start to feel our fingers splay apart, we give them a tap, and that's where their true hinge depth is. Now, while this might not be the most efficient for being able to long-term pick things up the ground, and we do want to do things such as soft tissue work and active stretching in the posterior chain, such as the hamstrings or the glutes, or perhaps some frontline work in the hip flexors, this allows us to get our client training in a position where they won't be compromised and not hurt themselves. Once we have their full hinge position, we then have them take a dowel or a PVC pipe and start drilling that movement to where their true depth is. Now, for each individual, this may be a little different. The true hinge means that the individual will bend with minimal knees, but maximum hip flexion while keeping a neutral low back. Once we have their true hinge, we then have the individual get comfortable and allow them to put their feet in a position where they can then allow their hips to go back as far as possible, and then we allow them to bend their knees. Here you can see the feet are a little bit wider, and then we allow the individual to hinge, trying to get as much depth as possible. As you can see, the stance is wider and the knees begin to bend. Again, the emphasis is creating as much flexion at the hip as possible. However, as we do this, we are also making sure that the low back still stays in a neutral position, so there's no flexion. As you can see, compared to the first hinge, the true hinge, we are able to get a lot lower to the ground. Ideally, this is where we are with individuals so that we can pick up weight from the floor. But again, we want to find the true hinge first. Hopefully, this helps you all discover quickly where an individual's true hinge is and then how they can get in the most optimal position to pull so that they can become stronger, but not hurt themselves.